Hello, everyone. This is Dr. Lulu, and welcome to the Thyroid and Hormone Health presentation. Today, I'm going to be talking all about how the thyroid gland affects our energy, our weight, and hormonal balance. So, grab a notebook, a pen for taking notes, and let's dive in. So, the thyroid is really connected to women's health in particular, and I'm going to just be discussing how and why that is. So, thyroid disease affects 1 in every 8 women through their lifetime, which is a huge percentage. And women have a 5 to 8 times greater risk of developing thyroid problems compared to men. And Hashimoto's thyroiditis, an autoimmune disease in which the immune cells attack the thyroid, is the most common type of thyroid disease. So that's really curious, right? Like, so why is that happening? And it's estimated that millions of women suffer from thyroid disease symptoms without ever being diagnosed or being diagnosed properly, and searching for short term treatments for their symptoms without knowing the root cause of the dysfunction. So, what's worse is thanks to toxins in our environment and other factors, the age of women having thyroid problems is getting younger and younger. So let's talk about some of the symptoms of thyroid imbalance. So when you look at this slide here, there are so many different aspects when it comes to thyroid dysfunction, which is one of the reasons why I think it gets misdiagnosed. And, let's just talk through some of these things. And they're related to lots of different systems in the body. So acid reflux, so digestive issues, that's a really common one that gets misdiagnosed when it comes to thyroid disease. Body pain, so systemic inflammation, cold or hot despite the weather. So that has a lot to do with your body temperature and the hypothalamus, cold hands and feet, comprehension or brain fog, short term memory loss, constipation, depression, difficulty getting pregnant, and miscarriages. So this is a key tie in to infertility. Digestive issues in general, GERD, abdominal pain, gas, bloating, all of those things. Fatigue, that's a huge one. High cholesterol, so in connection with the liver and how it's telling the adrenal gland and the thyroid what to do. Hives with too much sun, so breaking out in a rash. Inability to lose weight. Increased blood pressure, increased weight gain. Irregular cycles, irritability. Lifeless skin and hair. Limbs feel very weak, no energy to even move or exercise, loss of appetite, memory loss, outer 1/3 of the eyebrows missing. This is a good visual sign. Sleep all the time, so over 10 hours just wanting to sleep and never feeling rested. Slow heart rate, and then swelling or edema, puffiness all over your body. So that is a lot of symptoms and signs there that can be a key factor that there is something going on with the thyroid. So take a look at these and just think to yourself, maybe count through them like, okay, how many of these am I experiencing now? Maybe I need to dive deeper into thinking I might have a thyroid problem. So how thyroid problems affect women. So the thyroid affects multiple organs and pathways in the body, and thyroid disease is a huge effect on energy levels. And as a result, your libido is affected as well. And when you're running on low energy levels, you won't be in the mood for much, right? It's like you just don't have the energy to do anything. And thyroid hormones affect the pathways of other hormones. So thyroid disease can create other hormonal imbalances. So if you have an autoimmune thyroid condition like Hashimoto's or Graves' disease, so those are both autoimmune diseases of the thyroid, there's an increased risk that your immune cells will begin to attack other tissues. So there's a big correlation with other autoimmune diseases. For example, Hashimoto's and celiac are greatly connected. So you may have the ability, or you might develop another autoimmune disease in conjunction when you have an autoimmune disease of the thyroid. That's because, if you remember that slide before, so many different body systems are connected to the thyroid. So living with thyroid disease can significantly impact a woman's self-confidence, energy levels, work performance, family relationships, love relationships, friend relationships, everything in the life, it gets affected. So weight is a huge issue when it comes to thyroid disease, and it's weight gain and weight loss. And the constant struggle to treat the symptoms such as weight gain and fatigue without getting any lasting improvements can take a real toll on the mental health, right? It's like struggle, 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 and never get ahead. And therefore, getting diagnosed and starting treatment as soon as possible can completely change your life. So the real question is, should you get tested, right? So if you've been experiencing several symptoms that thyroid disease causes, like those symptoms from the slide before, it's really worthwhile to get tested. However, the problem with hypothyroidism, so hypothyroidism is when the thyroid is not functioning properly, right? Hypo, it's not functioning properly. And that's when there is a change in the way that the thyroid is interacting with the anterior pituitary gland, right? It's not having enough of that communication. And that's its symptoms are broad and then overlap with many other conditions. So you must get tested and have definitive results before you start any thyroid medication. So, right, I'm talking about Synthroid and things like that. Now, taking thyroid medication without having a thyroid problem could be as harmful as not taking it if you do. So, really, don't guess, right? Test, don't guess. That's really key. And you can bring on natural support for the thyroid in some specific herbs can really help without having to go down the pharmaceutical route. So, why are so many women getting thyroid disease? So, toxins are really key. And without even realizing it, we're exposed to thousands of toxins every day. And they're hidden in our cleaning products, our fragrances, and even the foods we eat. Of course, there are obvious ones such as air pollution. That's a huge trigger for the thyroid gland. And these toxins can interfere with thyroid hormone production. Okay, so we have the anterior pituitary gland tells the thyroid what to do. That's thyroid stimulating hormone or TSH. Then the thyroid has its own hormones that it releases in a feedback loop back to the anterior pituitary gland. So when the thyroid's not functioning properly, those hormonal levels will change. And some toxins affect the liver as well, and therefore impact the liver's ability to metabolize the thyroid hormones, which is really key because if it's not metabolizing them properly, there's going to be the wrong communication back to the body. And others directly affect the thyroid gland or hormones as well. So there's many different factors when it comes to the thyroid gland. And by encountering so many of these toxins daily, our bodies have a hard time detoxifying them fast enough, right? It's like there's just like overworking, spinning, trying to work fast enough to catch up to the toxins. So over time, these damaging effects add up and can have serious impacts on our health and thyroid hormones. So try to switch out some of your cleaning products for clean, toxin-free alternatives over time. Eat organic as you can, and of course, replace toxic fragrances and cosmetics with natural ones. So nutrient insufficiency. So nutrient deficiencies rarely go undiagnosed because they have severe and specific symptoms. So that's if you are having an extreme nutrient deficiency. However, many of us have vitamin and or mineral insufficiencies, which means we aren't getting an adequate amount to be healthy, but still have enough to avoid any serious problems. And that can be from intake or malabsorption. So some of these can be iron, vitamin D, iodine, zinc, and selenium. Those are all important macro or micronutrients for the thyroid specifically. And many women have insufficiencies in at least one of them, but also several come into play. And we're seeing, especially you might know this about vitamin D, many people are having an insufficiency of vitamin D and iodine and selenium, which are really key for thyroid health. And insufficiencies in some minerals, such as the or selenium, are linked to Hashimoto's disease. Go back to this one here. And many other conditions and health problems are also linked to insufficiencies in these micronutrients. So it's really key. So making sure you're eating a variety of fruits and vegetables every day. It also helps to eat different colors of fruits and veggies as a way to get your micronutrients. So eating like, red vegetables and fruits and purple vegetables and fruits and orange vegetables, and lots of greens. You're getting the full rainbow effect. And you might also want to take a multivitamin if needed, if you find you're still not getting enough of the necessary vitamins and minerals through food alone, right? If you're having a malabsorption issue. So we are constantly stressed, right? We're in this constant state of environment of stress. Either that is a acute stress where we're giving acute amounts of stress over time, like maybe like once a week you're in an acute stressful situation, or possibly you're in a chronic state of stress. So your thyroid gland is strongly affected by stress. It is connected to the adrenal system. So many of us are feeling overly stressed way too often. And this chronic stress is causing us way more damage than just our thyroid, right? There's many other organs like the adrenal gland that come into play, but it could be a cause of your thyroid disease. So the adrenal glands and other organs can be the actual cause of the thyroid dysfunction. So when we feel stressed, the adrenal glands release that cortisol, our stress hormone, right? And when cortisol is continuously released, it inhibits, this is key, inhibits the production of thyroid hormones, and we get hypothyroidism. So by finding ways to de-stress, such as exercise, meditation, or practicing self-care, it may significantly improve your thyroid health, and we'll see dramatic improvement in your overall well-being as well. So start prioritizing and treat your downtime with as much importance as a work meeting or commit with a friend. Like, you owe it to yourself to decrease these stress levels. So digestive issues. So your digestive system is full of bacteria, proteins, and broken down nutrients. So digestive issues such as leaky gut syndrome, that's where within the gut we have cells that connect together through tight gap junctions. And when those are loose due to stress and other dysbiosis in the gut, particles will leak through those little passageways into the bloodstream, causing an inflammatory effect. And that can create like a total mess in the immune system, and can lead to autoimmune disease and responses of the entire body, which is, can be known to cause Hashimoto's disease of the thyroid gland. And an imbalance in the gut microbiota, known as dysbiosis, can then trigger an autoimmune response if there are not enough healthy bacteria to out-colonize the invasive pathogens. One thing where it's really key to not only have the thyroid gland tested, but to do a stool test to see if there is dysbiosis. So either of these conditions can trigger the gut-associated lymphoid tissue, or our GALT. So that's our immune system of our gut, which is important for health, right? And they can be caused by food intolerances. So that could be sensitivity to, let's say, gluten, for instance, processed or artificial foods, so eating a lot of boxed foods, infections. So that can be viral or bacterial or parasitic, or taking too many antibiotics. So they can be caused by many different things, right? That's a lot of different things in the body. And they can be caused by food intolerances, processed or artificial foods, or taking too many antibiotics, like I mentioned there. That's a really key one. And food intolerances, such as gluten or dairy, can create subtle chronic inflammation in the gut that disrupts the intestinal wall barrier. And once this barrier is compromised, okay, so you have your colon, and once that barrier is compromised, what happens is then you develop that leaky gut syndrome, right? And things leak out through those gap junctions, and intestinal contents such as bacteria spill into circulation, which then triggers the immune response because the body sees these as a foreign pathogen. And ultimately, the overwhelming inflammatory response triggers that autoimmune disease. So hormone imbalances. So we have lots of different hormones in our body, and many products that we use in our everyday life contain synthetic estrogen-like chemicals known as xenoestrogens. So these chemicals are found in cosmetics, fragrances, and even plastic containers. And xenoestrogens are pro-inflammatory and play a role in the development of autoimmune disease by affecting the immune cells. So even natural estrogen can trigger autoimmune disease in some women who have more of the pro-inflammatory estrogen type. So thank you so much for attending today. I hope that you enjoyed learning about how the thyroid can affect different aspects of the body, the importance of thyroid testing, and how your body is affected when you have an immune response.